As chairman of the Europe region of World Physiotherapy, my name is Esther Mary Darcy, and I am delighted on behalf of the region to welcome you to this webinar, which is part of the Global Public Health Week organised by the World Federation of Public Health Associations. This is the second day, and today's theme is tackling the climate crisis. And our contribution will be about physiotherapy for sustainable healthcare in the Europe region. So coming to you as I am from a small village on the Atlantic seaboard, the most westerly edge of Europe, where I'm living by choice, having moved from the capital city for a better quality of life in 1985. I have witnessed over the years the changes in climate, but not actually its detrimental impact. And this for me sort of reinforces the existence of climate injustice, and that the people, and indeed our colleagues, who are suffering most from climate change are not the people who are causing it. So I think that we have an added collegiate responsibility to do what we can to contribute to climate justice. I've also lived with an environmentalist for nearly 4 decades. So way back in the time when environmentalists were considered as cranks. And I've been a physiotherapist for slightly more than that, which is hard to admit. But I've always thought that there was a connection between the two, but find it difficult to explain. And I am eternally grateful to the courage of Philip Marrock and David Nichols in establishing the Environmental Physiotherapy Organisation. It's a super organisation. And I really encourage all of you who are here this evening who are not members of it to join it. So we here in the Europe region, we were prompted to look at our, I suppose, responsibility to the Sustainable Development Goals by our Swedish association, who indeed have reorientated their whole strategy around the Sustainable Development Goals. So initially we developed a short paper, a one-pager on our commitment to consider the environment in terms of our travel and our meetings and our operational working. So this developed then into a more comprehensive document, which was led by Maria Busatil from Malta, Loredana Gigli from Italy, and Annie Palstam from Sweden. And the document was adopted at the last general meeting of the region last year. In fact, yes, last May. And these same colleagues will moderate and speak this evening. And I thank them in advance. And I hope that all of you will be inspired by their presentations. They'll look at the clinical aspect and they look at the political aspect, small p political, and that you'll participate in the debate that will follow. And I'm looking forward to hearing from you as well. World Physiotherapy has developed a policy statement on climate change and health, which goes before its general meeting this May, and which I hope the countries will support. I think that as physiotherapists, the obvious goal for us is SDG 3, good health and well-being. But I think that to see our role only in one SDG almost defeats the purpose of the SDGs. And I think that health is impacted by nearly all the other 16 SDGs and many of the 169 targets that are within those 17 SDGs. And indeed, Hans Kluge, the WHO Regional Director for Europe at the Europe Region Congress a few years ago, described these Sustainable Development Goals as a roadmap for humanity, and that rehabilitation was relevant to achieving several of those targets. I believe as physiotherapists that we can make a difference. I'm a firm believer in the power of one as individual physiotherapists, the power of the community as a community of physiotherapists at local level, at member organization level, at the European region level, and indeed at the global level. We have 37 country associations or member organizations representing nearly 200,000 physiotherapists. And they're active participants in the Europe region. Individually and collectively, we can act as both citizens of the planet and as physiotherapist professionals. And our ethical responsibilities as professionals have a role here. As both the physiotherapists and the profession, coming as we do from a combined science and health-based background, our knowledge and skills confer a real responsibility upon us. Not only do we have the responsibility to enhance the health of our patients, but we also have a collective duty of care to contribute to planetary health and to the Sustainable Development Goals. The UN has stated that the health service globally is one of the largest polluters. It's a huge creator of greenhouse gases. But physiotherapy isn't. So not only do we have a health economic input, compared, for instance, with surgery, but it also has a health environmental impact. So physiotherapy, as I see it, is a greenhouse gas alternative. It's an environmentally friendly healthcare practice, as Philip Mark suggested. And let's just look at a few quick examples. I know that my colleagues are going to speak in more detail, so I'm just going to touch on a few. But look at Sustainable Goal 7, affordable and clean energy. We can promote the use of clean energy and sustainable practices in healthcare settings. We can also ourselves in our practice use energy efficient equipment. We can reduce the use of disposable materials and single-use plastics. In Sustainable Goal 10, reducing inequalities, we and always should aspire to provide equitable access to healthcare services for individuals with disabilities, with chronic illness, regardless of where they come from, regardless of their socioeconomic status or their geographic location. It's not always achieved, but we must always aspire to this. SDG 4, quality education. Our physiotherapist educators provide quality education to our students so that our graduates in turn can carry out evidence-based practice. And we also have the Environmental Physiotherapy Agenda 2023, which is a commitment to include environmentalists in our undergraduate education. And I urge any of you this evening who are from the schools that if your school has not already signed up to it, to ask them to sign up to this. And as physiotherapists, we educate, but I have to say more importantly, we empower our patients to make healthier lifestyle choices, which in turn both reduces the environmental impact as well as the risk of preventable health conditions. The impact of climate change even affects workforce planning as we look at the emerging pathologies or the emerging evidence for related pathologies. As morbidity and mortality that affected from the effects of smoking are decreasing, the need for physiotherapists in respiratory area continues and comes from the impact of air pollution. Even as far back as 2017, the European Environmental Agency stated that 75,000 people die from nitrogen dioxide annually in Europe. I just find that a staggering figure. And then if we look at things like increased forest fires, increased particulate matter from diesel and burning fossil fuels. And indeed, this particulate matter is, as we now know, not only affecting lungs, but affecting blood vessels, putting pressure on the vessels and leading to stroke and heart conditions. And a recent all-island report in Ireland showed that about 1,000 deaths a year occur related to burning solid fuel in the homes. Weather patterns are worsening. People's activity levels go down in bad weather. People complain of increased pain in cold and wet weather. Inflammation rises in extreme weather. And all of this impacts on the demand for physiotherapy services. And we have to work to prevent, but also to meet the demands. The number of people living in cities has very recently tipped the balance of the urban-rural divide. There are now more people living in cities than in the country. And by 2050, it's estimated that 70% of the population will live in cities. Imagine the implications that this is going to have for the people who inhabit the cities and also for physiotherapists like ourselves trying to deliver services. Many would argue that as a healthcare profession, we should confine ourselves to treatment. But I believe, as many others do, and I'm sure all of you, that there is another argument. We must use our knowledge, our skills, our competencies to impact on population health through empowering people to attain, maintain, or regain a healthy lifestyle. Looking at treatment and our expertise in movement and exercise, the evidence shows that exercises undertaken outdoors are actually better than those taken indoors. I recently read a marvelous book by an Irish ecologist who incidentally was actually burnt out from communicating the ecological losses. But she wrote about connecting to the wonder of the natural world and how it helped her to recover. And she also referred to research that was done in Vancouver by Lem 2019, I think, which showed the health benefits from spending 2 hours a week in nature. So perhaps our exercise prescriptions can also add outside to them. It's a small word, but it could make a big difference. And before handing over, I just want to say, I don't think we can afford to sit back and do nothing. We have to be positive. Look at your practice, see what you can change. Even a small change will make a difference. At a World Physiotherapy Focus Symposium, which I was privileged to be a part of, I raised the idea about every physiotherapist planting a tree. And I know it sounds a bit corny, but imagine planting a tree native to your own country. Imagine if we all did that. Never underestimate the power of one. Singapore recently reduced its average city temperatures by 2 degrees through a citywide tree planting project. So now you will hear more ways about how we can contribute to sustainable healthcare from our speakers as I hand you over to our moderator, Maria Busatil. Thank you.
Thank you, Esther Mary, for a very inspiring start to today's activity. Definitely we'll keep the tips really close to us because they're very simple and we're basically, we can make a difference. Good evening, everyone. I'm Maria Busatil from Malta. I had the honor to work with Loredana and Danny in the past 2 years, 2 very inspiring physiotherapy ambassadors on the sustainable and development goals. I now give the floor to Annie from Sweden, who's a registered physiotherapist and associate professor. She's a board member of the Swedish Association of Physiotherapists, where she is chair of the Council for Ethics and Sustainable Development. Annie works as a researcher and senior lecturer at the Institute of Neuroscience and Physiology, University of Gothenburg, as well as the School of Health and Welfare, Dalarna University. Annie has a very strong interest in connections between health and the environment and tries to incorporate knowledge on these aspects into teaching and researching in physiotherapy to develop a field of sustainable healthcare. Annie today will be speaking to us about tackling the climate crisis, the role of physiotherapy for sustainable healthcare. Annie, the floor is yours. Thank you.
Thank you, Maria, for that nice presentation, and Esther Mary for a really inspiring start. Can you see my slide right now? Great. Okay, so I will skip this one. Esther Mary, you set the scene really nicely, and I'm going to continue on the same line here. So why should we act on climate change? And now by we, I mean physiotherapists and as health professions. So first, climate change, as Esther Mary said, is the biggest health threat facing humanity. And this was, it was said already in 2015 by the Lancet Commission on Climate Change, but it has also been said in 2021 by the Director General of the World Health Organization. So this is a really large health threat, which is already affecting health worldwide. And at the same time, the health sector, if it were a country, it would be the 5th largest emitter on the planet. So the health sector, whose mission is protecting, promoting, and taking care of health, makes a major contribution to the climate crisis and therefore has an important role to play in resolving it. So in this perspective, it's obvious that health professions should be leading the way, not contributing to the burden of disease. So going back to the basics on sustainable development. So the definition of sustainable development is a development that meets the needs of the present without compromising future generations of meeting their own needs. And in 2015, the UN member states agreed upon these 17 sustainable development goals. So this is a plan of action for people, for the planet, and for prosperity. And these 3 words, people, planet, and prosperity, represent the 3 dimensions of sustainable development. So people is the social dimension, planet is the environmental dimension, and prosperity is the economic dimension. And this is the most ambitious plan for sustainable development that the world has agreed upon, with a mission to end extreme poverty, to promote peace and justice, and to resolve the climate crisis. And all these 17 goals and 169 targets, they are connected and intertwined. So this means that you cannot leave a goal behind, but it also means that working to achieve one goal will have benefits for many other goals also. And we will come back to that later. So remember the 3 dimensions. This is a model of the dimensions of sustainable development illustrated as a cake. And this illustrates how a sustainable environmental dimension at the bottom with ecosystems in balance constitutes the foundation on which a sustainable social development lies upon. So this provides opportunities for human health and well-being. And on a sustainable social dimension lays a sustainable economic dimension, which is then dependent on the sustainable environment as well as a sustainable social development. However, much of the decisions made historically and today put the economic interests before the environmental and social issues with a sort of a flipped version of this model. So these perspectives really need to change in order to reach the sustainable development goals. And this also illustrates the concept of planetary health, which also Esther Mary mentioned. the planetary health, meaning that the health of human civilization depends on the health of the ecosystems on our planet. In the same, on the same line, Gary Cohen, who is president in the international organization Healthcare Without Harm, said that you cannot have healthy people on a sick planet. And this emphasizes just that we need to secure a sustainable environment to be able to secure health and well-being of people. And climate change already means negative effects on human health. And we are going to take a look at how. So this is really much information in this picture. It's from the Lancet publication from 2015, Commission on Climate Change and Health. And it illustrates how greenhouse gases in the green arrows coming from above affect the natural systems, generating extreme weathers, sea level rise, ocean acidification, and also involves simultaneous emissions of air pollutants. And all these have effect on human health, which you can see in the bottom in the purple boxes. So, for example, as Esther Mary said, cardiovascular diseases will rise as a consequence of, for example, heat waves, air pollutants, and extreme temperatures. And also respiratory diseases will increase relating to particulate air pollution and also by increased pollen levels in the air. Also, vector-borne diseases are spread by, for example, ticks and mosquitoes, which will thrive in new areas given the change in climate. As you can see, mental health is also affected. It's in a purple box, but without an arrow to it. And this publication is from 2015, and much has actually happened regarding research on this area since then. So I think we could put some arrows in there based on what we know today. So, for example, natural disasters, when villages are destroyed by floods or fires, that will, of course, create much suffering and mental health problems for the people who have had their lives destroyed. But also more indirectly, as many today, especially young people, are very anxious and troubled by the future that lies ahead. So what can we expect from the future? Well, actually, it's all depending on the direction we take from now on. And according to a Lancet publication from 2021, which has modeled future scenarios on population health, the Paris Agreement is a great investment in global public health if we succeed to adhere to it. So if adhered to, the Paris Agreement will actually lead to millions of lives saved annually. For example, 1.18 million less air pollution related deaths per year, and 5.86 million less diet related deaths, and 1.15 million less deaths due to physical inactivity. And mentioning all these millions less just gives you a hint on how many lives that are wasted due to these environmental issues as of today and in future. So we as health professionals, we need to be at the forefront of this issue, helping to create a healthier future. And as I said before, we have a double incentive, working to promote, preserve, and restore health at the same time as we work in a system which contributes to health deterioration on a large scale in the other end. And here again, from the Healthcare's Climate Footprint Report made by Healthcare Without Harm, the international organization which I mentioned before. If the global health sector were a country, it would be the 5th largest emitter on the planet. So, the physiotherapy perspective, what can we do about it? So I would like to argue that the best thing we as physiotherapists can do for the environment is to do a good job. So what do I mean by that? Well, I'm implying that physiotherapists already, by means of the professional toolbox, contribute to a sustainable healthcare in many ways. But we need to develop this further, evaluate it, and communicate it. And I'm going to give you a few examples. But first, let me introduce you to the concept of sustainable healthcare. So the Center for Sustainable Healthcare in the UK has developed 4 principles for sustainable healthcare. It's prevention, it's patient self-care, lean service delivery, and low carbon alternatives. And I'm going to take you through these 4 principles and give some examples of how physiotherapy could contribute to sustainable healthcare in these principles, respectively. So prevention, it's all about promoting health, preventing disease by tackling the causes of illness and inequalities, and thereby reducing the need for healthcare. And after all, the most sustainable healthcare is the one that is not needed. And an example from physiotherapy practice is health promotion and disease prevention by physical activity in many different ways. And the World Health Organization published a global action plan on physical activity in 2018. The report is called More Active People for a Healthier World. And it states that physical activity has multiplicative health, social, and economic benefits, and investments in policy actions to increase physical activity can directly and indirectly contribute to achieving 13 of the 17 Sustainable Development Goals. And I have put them there just so you can see which they are. So physical activity is a really potent intervention for sustainable development, which contributes to increased health, of course, but also in many other dimensions of social development as well as environmental and economic. And actually, I would like to recommend you that you would read this report. You can download it, and it has a whole appendix on the connections between interventions for physical activity and the connections to the SDGs. Okay, so this slide, it shows a graph on the global carbon footprint from healthcare divided on different healthcare activities or sectors. And you don't really need to read the text down there, but what I would like to show here is that preventive healthcare interventions, they have very small carbon footprint when compared to, for example, hospital care and medical retailers, which involves pharmaceuticals and medical equipment. As you can see, I put a red circle around the preventive healthcare. So there is a great potential for health as well as for the environment to prioritize health promotion and prevention in order to reduce further healthcare consumption, which is then associated with large emissions. Okay, so we move on to the second principle, which is patient self-care. And that is about empowering patients to take a greater role in managing their own health and healthcare. And I just put it as the heading that clinical practice of physiotherapy involves patient empowerment. It's sort of at the core of what we do. And I put the definition of patient empowerment from the European Patient Forum website. it says that empowerment involves patient education using the expertise of the patient, of their situation and context, and involving patients as equal partners in the management of their condition. And all these aspects are central to the clinical practice of physiotherapists. For us, it is essential to involve patients as active partners in rehabilitation, providing support and assistance based on their capacities of their own condition. And for example, patient education or supported discharge from hospital to better cope when at home after having had a stroke, or to recover after a hip replacement. So in this way, we can contribute to a sustainable healthcare, and that patients will better manage their own health, be more autonomous, and actually, or hopefully, seek less care in the future. And also having a better quality of life, of course. The third principle, lean service delivery, is all about providing the adequate healthcare interventions at the right time to the right patients, and to avoid unnecessary and ineffective care. And the Center for Sustainable Healthcare, they have done case studies to evaluate the sustainable value of healthcare interventions, and they let me use a couple of slides to exemplify this. In this case study, they did sustainability in cardiac rehabilitation. It's a case study of early mobilization by physiotherapists. So why did they do this? Well, early mobilization from 48 hours after admission to intensive care is well tolerated. It helps reduce muscle wasting. It's a powerful psychological motivator, and it shortens intensive care and hospital stay. And so what did they do? Well, 24 to 96 hours after open heart surgery, a therapist systematically initiated mobilizing patients. And these patients received 30 minutes of rehabilitation twice a day, continuing until discharge from the central ICU. And this is the evaluation part of the intervention. So they didn't only evaluate health effects or savings, monetary savings, but they evaluated health effects, monetary savings, carbon emissions savings, and also social effects on patient autonomy and staff satisfaction. And starting from the top, the health, patient had reduced ventilation days by 4 days. They also had reduced overall cardiac intensive care stay by 6 days. And this all resulted in total savings of £1,266 over 2 years. They did this during 2 years. And all this saved care, hospital days and ventilation days, also meant savings of carbon footprint. So they saved 48.5 tons of carbon emissions over 2 years. And the purple figure at the bottom shows the social dimension, which showed a more rapid recovery, quicker discharge, and return to daily life activities. Patients were actually more autonomous during their hospital stay. And this also increased staff satisfaction. So it was a win-win with positive outcomes on all evaluated measures, showing that putting physiotherapists where we are needed could actually save money, be good for health, good for staff, and good for the environment. So the fourth principle is low carbon alternatives. And this means prioritizing treatments and technologies with a lower environmental impact. So if two interventions have equal health benefits for patients, the obvious choice should be the intervention with least environmental impact. As it is now, health benefits are often or sometimes valued in relation to monetary costs, cost effectiveness, and health economics. But to reach a sustainable healthcare, environmental impacts of interventions need to be evaluated and taken into consideration in decisions on clinical practice. So one example is that avoided surgery could mean significant decrease in emissions. And I've chosen to focus on anesthetic gases here because it's a great subject for discussion in reducing environmental impact in surgery. Because I cannot say this word, anesthetic gases are potent greenhouse gases which make a significant contribution to healthcare emissions. And given this big climate footprint, efforts are being made for reducing emissions, and these include, for example, waste capture systems so that the gases do not enter the atmosphere, and also prioritizing and choosing to use gases that have lower emissions, because it could be quite a difference in the emissions of different gases. However, one perspective is totally lacking here, and the perspective is on the reactive healthcare system, which deals with the acute problems resulting from, for example, need for surgery. But with earlier interventions by, for example, physiotherapists providing conservative treatment with exercise and patient education to patients with, for example, osteoarthritis, many surgeries could actually be avoided, also cutting emissions from anesthetic gases. So physiotherapists can provide proactive treatment, reducing the actual need for surgery. I have one other example on this principle, and it's a non-pharmacological treatment should be first choice if patient benefits are equal. So this is also a slide that I have been given from the Center for Sustainable Healthcare in the UK, and it shows how emissions from the healthcare system in the UK is distributed between activities. And this shows that medical equipment such as single-use materials and other equipment, and also pharmaceuticals, contribute the highest emission from healthcare. So in this perspective, we could argue that physiotherapy is a non-pharmacological and resource-effective alternative in healthcare, which can contribute to a lower carbon footprint by decreasing aspects in healthcare with the highest emissions. So at this last slide, I would like to return to this statement, as I said earlier, that the best thing we as physiotherapists can do for the climate is to do a good job. But I would also like to add that, yes, it is important that we do a good job, and we already contribute to a sustainable healthcare. But it's really important that we start evaluating our interventions from a perspective of sustainability, and also advocate for such evaluations to be implemented in healthcare on a large scale. We need to move in that direction to steer towards a sustainable healthcare and a sustainable society. And when we start evaluating healthcare from a sustainability perspective, including environmental impact of interventions, the value of physiotherapy for sustainable healthcare will be obvious. So we need to be aware of how sustainable we are and how sustainable we could be as a profession, and to advocate our role for sustainable healthcare for the sake of current and future health and a sustainable future. Thank you.
Thank you, Annie, for a very interesting presentation. I'm going to applaud. Annie has very much given us a practically oriented model to even what we think that the SDGs are not related directly to our profession. So, you know, the wider view is getting there. We know that every little bit makes an impact, and thank you, Annie, for describing it. Now I would like to move on to Loredana, who will give us a better overview of the political, with a small p, side of us advocating the SDGs and our greener approach to health. Loredana will do a brief introduction.
Yeah.
Loredana is from Italy, La Bella Roma. She is the head of the rehabilitation staff in a public health company based in Rome. She's a lecturer at the Rome, Unicamillus and Sapienza universities, interested in bringing the profession towards sustainable and lean approaches. Loredana will give us an overview on the document that the Europe region of World Physiotherapy has endorsed last year, which is titled The Harmonization of Sustainable Development Goals within the Physiotherapy Profession. Loredana, the floor is yours. Good luck. Thank you.
Thank you to you. Thank you everyone to attend this webinar. This is very interesting. Thank you to Europe Region. Let me thank most of all my colleagues, Europe Region first of all, and then Maria and Annie, because working with them in the last 2 years about this theme, this topic, this very important topic, opened my mind to a point of view that maybe I would have not if I didn't meet them. So thank you, Maria. Thank you, Annie, for your expertise in this topic. And thank you, Europe Region, to let us work on this. So as Maria said, I will give you an overall on the paper that we present and that was approved on the last general meeting that was held in Prague last year in May, the Harmonization of Sustainable Development Goals within the profession. This was our last meeting in Prague, where our paper was presented and approved. Which is the purpose of this paper? Is twofold. Firstly, to outline the need for physiotherapists to adhere to the SDGs in their daily practice, which includes the clinical, educational, research, management, and policy practices. And secondly, to promote physiotherapy practice as a more sustainable health service, since it is a lower contributor to greenhouse gases when compared to the other health services. Given the strong contribution to and further potential impact of our profession on sustainable development, we have an impact on our patients as well as on our working environments, with the ultimate goals to create sustainable measures that affect not only us and our patients, but also the future of the physiotherapy profession and the environments we operate in healthcare and society as a whole. This proposal is in line with the strategic priority of World Physiotherapy, which states a community that has global influence and brings about changes in health policy and practice. And it also is addressing the goals from the strategic plan of the Europe region World Physiotherapy, which are promote excellence on physiotherapy education, practice and research, and engage in relevant policy development at EU and national level. So, as Sani well said, the combination of health impact of climate change and the health sector itself being a contributor to climate change led the Centre for Sustainable Healthcare in the UK to develop 4 principles of sustainable healthcare that are, as we see before, prevention, patient self-care, lean services delivery, and low carbon alternatives. According to the World Health Organization, health is a contributor to several of the SDGs, but health priorities agenda for sustainable development will remain aspirational unless strategies to transform the health workforce capability are put in place. Physiotherapists are an ideal health workforce to address the good health and well-being, quality education, and gender equality goals. How can we improve, and how can we act to contribute to a sustainable development goals? Patient empowerment and self-care. Annie said yet, but we can add some other consideration. For example, it's important to understand for us as professionals that physiotherapy focuses on management, health promotion, and prevention of a broad range of lifestyle conditions. Patient-centeredness in physiotherapy entails the characteristic of offering an individualized and tailored treatment, continuous communication, verbal and non-verbal, education during all aspects of treatment, working with patient-defined goals in a treatment in which the patient is supported and empowered with a physiotherapist having social skills, being confident and showing specific knowledge. To realize this definition of empowerment by the EU Joint Action on Patient Safety and Quality of Care, that is defined as a multidimensional process that helps people gain control over their own lives and increases their capacity to act on themselves defined as important. Collective empowerment is a process through which individuals and communities are able to express their needs, present their concerns, devise strategies for involvement in decision-making, and take political, social, and cultural action to meet those needs. So I think this is a very, very important role and skills that we have to improve in our profession. About prevention, we can say many things about prevention. Annie said many things, many important things. We have to consider that physiotherapy advocates for wellness, fitness, health promotion, management of disease and disability, and has a dynamic link between health and health services delivery. The global burden of disease study that was performed in 2010 reported that there are more young adults suffering from non-communicable diseases that could lead to death and disability worldwide, and we know very well. In addition, we have to think about the cost of amputation, for example. Artificial limbs, wheelchairs, and cardiac surgery place an enormous financial burden on health budgets. Physiotherapists, as members of the health promoter community, play a significant role in health promotion, wellness, fitness, disease and disability prevention and management for individuals and populations by acting as a link between health and health care delivery. Meaning, physiotherapists took advantage of this chance and their expertise to assist individuals and populations in improving their overall health and avoiding health problems. Education, direct intervention, research, and advocacy are all possible roles for physiotherapists, in accordance with the profession's objective of empowering people to take charge of their own health. Lean services delivery. I love very much the lean approach that I'm sure many of you know. And according to the lean approach to healthcare, it is mandatory to identify and correct the wastes and the overuse in healthcare. We have an example, a recent example. The COVID-19 pandemic has exposed the weaknesses associated with global healthcare management. In a few months, the unpredictable and uncontrolled infection spread severely, impacting several sectors worldwide. Several countries' governments were unable to stop or control the spread of COVID-19 infection despite measures, every kind of measures. Delay in developing the vaccines worsened the spread day by day, resulting in an unprecedented surge in healthcare demand, due to which the entire healthcare supply chain got distressed. The lean perspective can improve the quality of physical therapy from the patient's point of view and at the same time take into account service provider limitations. So lean approach and less is more. Low carbon alternatives, and he said very well, a complete examination of this kind of problem. We can give some other example. We can act some easy behaviors in our daily routine to reduce or to have alternatives about low carbon. Just to give an example, there is evidence that non-pharmacological airway clearance therapies in hospitalized patients is effective. Thus, the reduction of using pharmacological treatments contributes to the reduction of carbon emissions for their production. This is just an example. Or maybe we can reduce the use of non-disposable products. It's easy. We have to recycle. We have to save energy. We have to behavior every single step of our work with simple and easy stuff that we can act every day. Just, for example, turn off the lights when we go out from our work. So, what are the recommendations of this paper from the perspective of Europe Region World Physiotherapy? Europe Region World Physiotherapy endorses sustainable and environmental responsibility in the face of the climate crisis and its relevance to health. And we, in this paper, give some recommendation. The Europe region is proposing to develop the development of guidelines on the following topics: SDGs and physiotherapy practice, to help physiotherapists to contribute to the SDGs. To draw the Europe region environmental guidelines and to involve physiotherapists in the European Green Deal. European region is proposing to implement the following initiatives: include the SDGs in the discussion session of the organization, promote the inclusion of the SDGs in entry-level physiotherapy programs. It's very important to grow the awareness of this kind of focus of topic from the very start point of the studies in physiotherapy, to raise the awareness of our young colleagues. Promote the consideration of the SDG whilst addressing global crises such as pandemics. Include the SDGs in the webinar series of Europe region. This is an example this evening. Promote the active participation of physiotherapists onto committees addressing SDGs within the health sector. Support environmental initiatives in Europe region, such as promoting remote hybrid congresses, remote working, public transport usage, and promote reductions in travel, printing, single-use plastics, water and light usage. Set reduction targets such as reduce in-person executive committee meetings by 10% and reduce in-person working groups meetings by 25% per term. And we are acting like this because we have reduced our in-person meeting, so reducing the transport, the flights, for example, because we come from every country of Europe, so we have to use flights, and it is without doubt a great impact of emissions. And the Europe region is also proposing to assist the current physiotherapy practices by raising awareness on sustainable development among physiotherapists, empower physiotherapists to increase their positive contribution and to reduce negative impact on SDGs in their daily work, promote the profession as one of the lowest contributors to emission of greenhouse gases within the health sector, encourage and support the member organization to be environmentally aware for the SDGs in physiotherapy practices, and encourage and support the member organization to develop their own organizational environmental policies. These are you may think that these are obvious recommendations, but I can say that, for example, in Italy, my beautiful country, we have to raise in a great way the awareness about this topic, because there is not so much attention. So from the moment that I started to work on this topic with my colleagues, I started also to spread the information, the awareness, and I found that most of my colleagues are not so involved and not so informed and not so aware of which is the problem. So I don't know, in your countries, for example, in Sweden, in Italy, sorry, but I have to say in Italian, in Sweden, any gioca facile plays easily, because Sweden has a great awareness about this topic. In Italy, for example, it's more difficult to go through this kind of cultural change, because it is a cultural change we have to make. So if you want to look at our paper, you can download at this link that you can see. I will put a new on the chat so you can download if you want and read. It is a work in progress. We have to go on with this kind of work. And we are very glad to be hosted here this evening. Thank you to all.
Grazie Loredana. Thank you, Loredana. Applause to you as well.
Grazie.
So, instinctively feeling Annie's conversation on the clinical practice and listening to Loredana going on the political mode, I would say that why not add a new performance indicator in our setups? That is, if we use a greener approach, we have better management setups, better clinical setups, better patient empowerment setups. So it could be something for your future assessment frameworks within service management to include. Definitely, the matrix of the SDG goals can help you to, develop a model with regards to what you need to do at your service management level and your clinical practice level, and also at your educational level, because obviously we need to train our current workforce, and it's a new topic for all of us. So we are lucky to have Annie, Loredana and I are lucky to have Annie, who's always explaining to us new concepts. But obviously, current workforce and future workforce need to be trained in order to be able to engage and enhance this SDG-oriented approach. Thank you, Loredana. Thank you, Annie. Now it's finally discussion time, the best part for me of every webinar. And I am very glad to introduce a colleague from Ireland, which I really do hope that I'll have the time to connect perhaps in a more, long-term way. Esther Mary, she's a colleague of yours, right? Maka from Ireland. Maka, I leave you the floor. You can unmute yourself. Just go for it. I know you have a lot to tell us.
Thank you, Louisa, Mary-Louisa. Thank you
And
so much.
hello to your dog as well. How sweet.
She has to be quiet here because she takes no prisoners, let's just say.
It's good. Maka, the floor is yours.
Just to say, I am so pleased to see Philip Marriage here, and Esther Mary and Karen Roberts also from Ireland. I think this is one of the most important topics for the European region, also really for WCPT and also for the national societies of physiotherapy. I have fallen into this by lecturing the physiotherapy students in human rights. And as we know, the SDGs have been based on a framework of human rights. Now, the legal end of things make things very cut and dried, but the Universal Declaration of Human Rights started off as aspirational in the General Assembly. And these SDGs are also equally interlinked, inextricably linked. You can't have one without the other, but they're also aspirational. But I'm hoping that they're also preventive, a culture of prevention of what's about to come next, which of course is climate change. Look, all I can say is I hope as many people as possible will join the Environmental Physiotherapy Association. It's been absolutely fantastic. Philip, congratulations on it. I'm just wondering what other countries are doing with regard to lecturing. So my lecture on human rights has progressed into a lecture, I suppose, on sustainable development and the importance of it, and the relevance for physiotherapy. I'm wondering what other countries are doing, and I would love to see a planetary health report card crew start up in Ireland for the physiotherapy discipline. The occupational therapists have done it, the nurses have done it, and the doctors have done it here. We're lagging sadly behind. So any advice from other people here would be really, really gratefully accepted. Thank you.
Thank you, Maka. I can really feel your energy in all of this. Obviously, if I may comment, the digital world has advanced a lot during the pandemic, so we can use that, to have a good knowledge share like we're doing today, even at national level, to nations together, or at organizational level. So I'm sure you'd be available to assist as needed. I will pass the word on to Annie, because I can see the fire there, right, Annie? Annie, just go ahead and feel free. And then Loredana, would you like to pass a comment straight after Annie with regards to what? Okay, so you can continue straight away. Thank you. Annie, there you can reply to.
I just wanted to share a bit of a Swedish educational perspective, working in the university setting. It's actually been in how is it in English? Educational Act since many years, that all higher education must include education on sustainable development. Actually, before 2015, when I think it was actually 2009, but I might be lying. It was before 2015 anyway, before Agenda 2030. That said, it's hard to implement actually, and it's not that easy, and it could be much more integrated and used sort of more in relation to every profession, like we talk about physiotherapy and sustainable development today, but that's really not the case, unfortunately. all the physiotherapy educational programs in Sweden are working on it, and we're actually right now doing research on this, where we are collecting all the curriculums, I hope that's the right word, curriculums from the courses in the educational programs to see how sustainable development is integrated into the educational program. So we're just collecting data right now, but this is an effort to sort of see what support is needed, because it sort of came into the legislation, but the support for the teachers to provide this is not really there. And it's been many years. Thank you.
Thank you,
Annie,
Annie.
thank you so much. There is a bank of slides. I'm sure I've said it before from the Planetary Health Alliance. And there is a nurse there, Teddy Potter, who is, I think, she's much more than a nurse now, and she has a bank of slides that can be integrated into all kinds of curriculum, particularly for health professionals. And so each lecture is kind of put on them to pick out the slide that talks to them so that they can introduce it into their lecture. So it's not a new topic or anything, it's just brought into their lecture. And if it is, there is a little logo at the bottom to say, this is part of your planetary health education. So I think that's kind of it's a nice way to do it. I'm not saying it's happened everywhere, but I'd like to see more of that happening. Yeah, and I also think that the physios have a huge onus on them under the inclusion and diversity policy of WCPT to be advocates for our clients and our patients. And that's our only agenda, really. From the cake, I think it was, I can't remember who was showing the cake, the wedding cake of the SDGs, and the middle of it is on economics. And I think that's the bottom line. Yes, the resources are limited, but for physios, sometimes economics is not our primary goal. Let's face it, there's kind of a systems thinking where you might compromise. Let's say we're not all going to be rehabilitated back to normal. And I think physios are very well aware of that and have transferable skills for it. Thank you.
Thank you, Marta. And Loredana, you can go ahead.
I agree with Maka that this is not the first worry of physiotherapists to contribute or to have skills in SDGs. I agree, but I think from another point of view that we could, how can I say in English, we could involve them using other strategies. And I'm speaking as a head of a rehabilitation staff of a large public company in Italy. And I have this kind of responsibility, for example, because if I say to my colleagues, physiotherapists, you have to contribute to the SDGs, they look at me and tell me, are you full? What are you saying? What are you speaking about? Yeah. So if from another point of view, I try to make them understand that our intervention is useful to reduce costs, for example, or to put a goal, an objective in our organization. We are organized in objectives. Now we have to reach some objectives at the end of the year to make them rise a professional to be proud now that their work is useful to reach that goals of the company. I can reach the same goal of the SDGs using their professional skills. I don't know if I was capable to make you understand what I mean with this with these words. I mean that is we cannot pretend that I am speaking for my country. Of course, I can pretend that my colleagues from one day to the other awakes and are aware of the climate change and how physiotherapists can contribute to reduce the emissions and so on. But I'm sure that if I how can I say, Maria, aiutami, se stimolo
Continua, che faccio la
riesco a
sì,
non è solo stimolare, come si dice in inglese.
To stimulate, to empower, to motivate,
to stimulate their professional skills, I can reach the same goal. I can use another, I'm trying to use other ways to reach this goal. To start and to raise and introduce this topic in their daily routine.
Okay, so thank you, Loredana. I'm really feeling here perhaps a future direction to start looking at quality indicators within management approaches, clinical approaches, educational approaches directly related to our greener approach to physiotherapy. And I think if we take stock of good practices here within our 5 clear dimensions of physiotherapy practice, we might get going on a very interesting matrix. I'm going to leave the floor to Loredana, to Annie again, because she wants to add up on something else. In the meantime, I'm seeing that Philip in our chat is he's promoting, that universities and organizations do, join this famous movement. Please, let's make a plea at the end of this, that we'll do, try at our national level to promote it with our organizations and our educational universities. Annie, you can give us your feedback about what has been discussed earlier on. Thank you.
Yes, I just wanted to share, because I think some really good things were taken decision on and were approved in Prague in the general meeting. And I just wanted to emphasize something. Can I actually share a document? I will share just to show you that this document was also approved at the in Prague at the general meeting, a statement on physiotherapy education of the Europe region. And I just wanted to show you, just so you know that it's there, that in the, sorry for the fast scrolling, education policy statement recommendations. And in here, it actually says the curriculum for physiotherapy education reflects national as well as global health and social priorities and include a perspective of sustainable development. So this is in the education policy statement recommendations that was approved in at the European Region General Meeting last year. I just wanted to take a chance to show you that, so that sometimes you just need to have you want to promote something in your country. It's really nice to have some document in your hand. You can show that this happens somewhere else. What are we going to do about it, sort of?
Thank you, Annie. I'm seeing that Loredana has raised her hand, but before Loredana, perhaps you can latch on to it. I really wish to put on the floor the relationship between climate change and mental health. We know that this has an impact on our patients, on the health workforce. We know that Europe Region of World Physiotherapy now has a thematic group who is directly dealing with mental health. And perhaps if we want, to direct the discussion onto that topic, I'd be more than happy to support you on that. Loredana, I give you the floor. Thank you.
I was looking at a comment from Philip Maric that say that we still have no participating universities from Italy. on the EPT agenda 2023. Would be great to have a first, then a second, third, and so on. I totally agree, Philip. I would be happy to see it, but it is it is what I was saying before, that unfortunately in Italy we still not have the right awareness of the importance of this topic, and so we have a great responsibility also through our organization to spread the information. We have to start, and I hope we will see the university in the EPT agenda 2023 soon. Thank you, Philip.
Any comments on the mental health element, Loredana, or you want?
Yeah, sorry, because I was answering to Philip because it was very interesting. And yes, of course, mental health, and there is a great relationship within with environmental, and we saw. I ever refer to the recent pandemic we went through, because it was a great challenge. But I consider it also a great teacher, the pandemic itself, because it gives us many exposures to our weaknesses and to the healthcare weakness. About mental health, there is a particular attention on the contrary of the environmental position in Italy, and so it is clear, and there are the best evidence also in Italy that is basic to, they go together to the same way, and there is a close correlation between climate change and mental health diseases. Just like Annie said in his presentation, he made an example very interesting about this.
Thank you, Loredana. I wish to read a comment from a colleague of ours, Eva, who cannot contribute because she is moving from one place to the other right now. And Eva is saying that the SDGs, as well as the lean concept, can and should be deliberated through the conceptual framework of quality in terms of clinical setting, processes, and outcomes. And brainstorming is very good. Is very important if we want to have a good matrix. So this has put us, directly on the practical mode of how are we going to get there. I think Loredana and then we're going to have a bit of a couple of busy days or months in the coming weeks to be able to, analyze all of this. But thank you very much for your approach and for this, chat, which has so much going on in it. Also, I'm noticing the student, if you allow me, if you give me a second, Loredana, and Esther Mary has Sylviane. Sylviane is rightly saying that perhaps European students should be made more aware of all of this. Because we're talking about the educators, but the recipients really know. And perhaps, for all we know, they could be the leaders, the ambassadors within our clinical settings to be able to break the status quo. I mean, I'm the one that, goes to the younger generation for technological issues because I know that they are the experts. So they can be our ambassadors of a greener approach to healthcare. So thank you, Sylviane, for your very interesting and practical comments. We'll be able to connect and, look into it further.
I think he wants to speak there, Maria.
Okay.
Sylviane. Yeah.
No,
Sorry,
not especially. Just
sure. I missed that. Thank you, Esther Mary, for your kind support.
I note that Sylvain is a French student in physiotherapy in a European university in Spain. I think it's not non è un caso. Translate, please, Maria.
It's not you know, a fortunate case. There's a reason behind it.
That he is from south of Europe. I have to evidence this. There is there are great differences in this in the awareness about this topic between south of Europe and north of Europe, and so we have to do a great work. And as Sylvain says, he's asking himself now to if it is a good idea to sensibilize. It is not a good idea, it's a great idea, it's a basic idea we have to do, because we have to start from the studies, from the time you are during the studies, because the things I was saying before, when you are involved in your work every day, you are busy with your work, maybe you are not thinking about much more about environment, but if you raise your awareness during your studies, just as the I don't know, the manual muscle testing, for example, you could make the difference.
Yeah, if I can give an answer, for me, it's the point. If you could sensibilize, it will be very great, because yeah, we don't talk about it at school, and yeah, if we want to change the future, we have to think about the next generations. So yeah, it will be the best to do for me.
It would be a topic starting from a primary school, I think.
Mm-hmm.
Okay, thank you, Esther Mary. You can go next.
Thank you, Maria. Sylvain, I'm delighted to see you here in your capacity as a student, because I think, based on what the others have said as well, we are very dependent on the students to raise this issue. And I see that Philip has mentioned that it is present in some schools in some schools in Spain and Portugal are participating in the Agenda 2023. So perhaps you and your classmates can put some pressure on your university to take that up and to ensure, as the agenda says, to include environmental awareness in the curriculum, and certainly we can help you with that. So.
Thank you, Esther Mary. More work on our agenda, right? Well done. That sounds very interesting. Annie, I give you the floor, and perhaps you can start as well, giving us your concluding remarks, because time is, pressing us. Thank you.
I want to agree with Esther Mary. It's really nice to see you, Sylvain, as a student here, and having lectures and educational activities with physiotherapist students on sustainable development in Sweden. It's actually really new to them also to think about themselves as a profession that could work towards sustainable development, even in Sweden. It's very much focus on, I think, the individual level, what you could do at home. Everyone is very aware and wants to do as much as they could, especially young people, of course, with all active transportation and recycling and everything. But it's so important just to empower students that in their profession they could actually contribute to really small changes. But if they're made systematically, if you could advocate for the systematic change of a really small thing, it could actually be a very effective. you shouldn't stop recycling or cycling to work or anything, but we have so much, you said it so well, Esther Mary, about the shouldn't, I cannot say it, but the one person has a really important role, but also if we can do something as a community together, it has really great power.
Thank you, Annie. Loredana, do you want to give us some concluding comments before we start closing off the event?
I want to thank you all, because it was a very interesting discussion, and I'm happy because to see all of this interest in this topic. And my conclusion is that we have to do much work about this. So the next 2 years, Annie and Maria and Esther Mary, as our chair, will be dedicated to develop this topic. Sure. Thank you all.
Thank you all for a fantastic event. So when I moderate, I usually write down the keynote so that at the very end we have a clear take-home message. So Esther Mary started with a very important word. Physio should seek climate justice, which includes equalities, a new framework of performance indicators that do measure our greener and healthier and greener approach to health. Esther Mary also mentioned the power of unity, the intra-professional unity and the interprofessional unity, together with other advocates that are, that want to move in the same direction. With unity, I would like to add the Environmental Physiotherapy Association and the Physiotherapy for Future, which happens every Friday. So let's be united. Let's, just do our little bit to be able to enhance our impact factor within our communication strategy. There's also ethics. There's also our economic side, the social side, which brings us back to our environmental side. We have to remember patient empowerment, equality, our preventative element, which is always there everywhere we go, even if we're seeing something else, and the lean service delivery, less for more. Also, I wish to say something else, that as physios, Annie really explained it nicely. I mean, this is my take-home message, apart from the fact that we have a lot of work to do, but that's another message. She said that the best thing that physiotherapists can do to climate is to do a good job. Why? Because we are a greener and better version of all the other healthcare modalities that we use. So remember, advocate it, live it, and also be an example to everyone, because example might speak more than 1,000,000 words.
Of course.
I thank you very much. I thank the World Federation of Public Health Alliance for such great feedback on the chat and for amazing coverage through social media. So now, please do go on Twitter and Facebook and see all the things that were posted during our presentation. Remember, we have recorded it. It's going to be available on YouTube. Nothing stops you, for example, to showing it to your students if you have time to do that. Thank you very much. I wish you all a good evening, and hopefully we see you in another webinar on climate change and physiotherapy very, very soon. Thanks a lot.